If you're over 60 and engaging in daily self-pleasure, what I'm about to reveal could save your life from prostate cancer or restore the intimate abilities you've lost. I know this sounds hard to believe, but that's exactly what I'm going to share with you in this video. I'm Dr. Michael Anderson, and I've dedicated 35 years of my life to studying men's health, especially those problems that men are too embarrassed to talk about with anyone. Throughout my career, I've helped thousands of men avoid prostate cancer, regain their confidence in the bedroom, and most importantly, bring peace of mind back to their families. But today, I have to do something that many of my colleagues won't like. I'm going to expose the biggest lie that the medical establishment has been hiding about what daily self-pleasure really does to your body. You know, for decades, we've been told that self-pleasure is completely harmless, even beneficial. But what's the real truth? The latest research that I've been involved in shows a completely different picture. And what's most frightening, most doctors aren't telling you about it. By the end of this video, you'll know exactly what the medical industry doesn't want you to know. Does daily self-pleasure really cause cancer? How is your prostate changing every single day without you even knowing it? What frequency is actually safe for a man your age? And most importantly, something I know you're worried about if you've been doing it wrong for years. Is there still a way to completely restore your abilities? I'm going to share real stories from my clinic, hidden research studies, and most importantly, the specific methods you can start using today to turn things around. Before we get started, if you haven't subscribed yet, go ahead and tap that button and turn on the bell so you never miss important health insights made specifically for men in their 60s and beyond. And if this video speaks to you, type 1 in the comments. If not, type 0. I value your feedback and it helps me create content that truly serves you. If you're experiencing any prostate symptoms like waking up multiple times at night to urinate, burning sensations, or difficulty starting urination, then the information I'm about to share could be the key to saving your health. So, watch this entire video right now. Don't wait until it's too late. Part 1. The Truth About Prostate Cancer. I want to start with the story of James, a 63-year-old patient who completely changed how I look at this issue. 3 months ago, James walked into my clinic with trembling hands, holding his biopsy results. His PSA level had shot up to 8.5, double the normal range, and his previous doctor suspected prostate cancer. James sat across from me with red, watery eyes and said, "Doctor, I'm terrified. I think I may have caused this disease myself." When I asked about his daily habits, James hesitantly admitted something he'd never told anyone. "I've been pleasuring myself every single day for the past 20 years. I think that's why I got this disease. My wife doesn't know, and I feel like I've destroyed myself." The fear in his eyes is something I see in most men facing this situation. But here's what James and millions of other men don't know. I spent 2 years thoroughly researching this connection, and what I discovered will surprise you. The largest study ever conducted by Harvard University, following over 32,000 men for 8 years from 2016 to 2024, showed results that were completely opposite to what people expected. Men who engaged in self-pleasure 21 times or more per month, that's about 5 times per week, had a 20% lower risk of developing prostate cancer compared to those who rarely did this. Sounds good, right? But this is where things get complicated. Because when researchers dug deeper into the data, they discovered something concerning. Men who engaged in daily self-pleasure, that's more than 30 times per month, actually had a 15% higher risk of chronic prostate inflammation. And chronic inflammation, if left untreated, can lead to other serious complications. So what's happening here? Why is there this difference? The answer lies in a basic medical principle we call use it or lose it. Your prostate is like a muscle. When you use it regularly, it gets stimulated, blood flows well, and healthy cells regenerate. But when you overuse it, like working out too hard every single day, your body doesn't have time to recover. Every time you climax, your prostate has to work extremely hard to produce prostatic fluid, which makes up 30% of your semen. When you do this daily, you're forcing your prostate to work continuously without any rest time. The result is inflammation, swelling, and eventually tissue damage. So, what's the answer to the question that James and millions of other men are asking? No, self-pleasure does not cause prostate cancer. In fact, it may even protect you from this disease. But, and this is the most important but, frequency is the key to everything. 2 to 3 times per week, that's actually good for your prostate health. It's like moderate exercise, enough to maintain health but not overdoing it. Daily? That's when real problems start to appear, and I'm going to show you exactly what's happening to your body when you cross that line. Now you might be wondering, okay, I understand about cancer risk, but what exactly is happening inside my body right now? The next story will show you the truth about changes happening in your prostate that you may not even realize. Part 2. How your prostate is changing. I'll never forget the scene when Robert, 72 years old, walked into my clinic with a tired and defeated look on his face. He told me, "Doctor, I can't sleep anymore. Every night I have to get up 5 or 6 times to urinate, but each time only a few drops come out. When I do urinate, it burns, and I feel like my bladder is never completely empty." Robert was a retired engineer who lived a healthy lifestyle, no smoking, no drinking. So what had happened? When I did an ultrasound on him, the results truly shocked me. Robert's prostate had swollen to twice its normal size, and the surrounding tissue showed signs of serious inflammation. After asking detailed questions about his daily habits, Robert sheepishly admitted, "I've had the habit of pleasuring myself twice every day for the past 10 years. I thought it was good for my health, helped me relax. But now, I'm wondering if that could be the cause?" And Robert was right to be concerned. What was happening to his prostate was a step-by-step deterioration process that I've witnessed in hundreds of other patients. To help you understand clearly, I'm going to describe exactly what's happening in your body, stage by stage. In the first 4 weeks when you start daily self-pleasure, everything seems very positive. Blood flow to the prostate increases, cells get better oxygen and nutrients, you might feel more sexually vigorous, and mentally you feel healthy. This is the stage where most people think they're doing the right thing. But after the 2nd month, through the 6th month, your body starts to fight back. The prostate, after being continuously stimulated without adequate rest time, begins showing the first signs of chronic inflammation. You might not notice it yet, but the gland has started to swell slightly. You might occasionally feel discomfort when sitting for long periods, or feel heaviness in your pelvic area. By the first year, the changes become more obvious. The prostate begins to enlarge, growing abnormally to cope with the chronic inflammation. This is when urination symptoms start appearing. You might notice that your urine stream gets weaker, it takes longer to start urinating, and especially, you're waking up at night more often than normal. But the most frightening thing happens in the long-term stage. After years of overuse, the prostate tissue begins to scar. This means healthy cells are gradually replaced by hard scar tissue. Once this happens, the damage can become permanent. The ability to produce prostatic fluid decreases, sexual function declines, and most importantly, your quality of life is seriously affected. Now, I need you to be honest with yourself. If you have 3 out of these 5 symptoms, you need to stop the habit of daily self-pleasure immediately. First, you wake up more than twice each night to urinate. Second, your urine stream is weaker than it used to be. Third, you feel burning or discomfort when urinating. Fourth, after urinating, you still feel like your bladder isn't completely empty. And fifth, you sometimes feel pain during climax. These symptoms are not signs of normal aging. They are warning signals from your body that your prostate is being damaged. And the good news is, if you catch it early, we can completely reverse this process. Let me show you a simple test you can do at home. The next time you urinate, count the time from when you first feel the urge to urinate until urine actually starts flowing. If this takes longer than 10 seconds, that's a sign of blockage. Next, observe your urine stream. Is it still as strong as it used to be, or does it now just dribble or flow weakly? But the most important thing I want you to understand is that these changes don't just affect urination. They're silently destroying another aspect of your life, your intimate abilities and confidence in the bedroom. And that's exactly what I'm going to reveal in the next section. Part 3. Why you're gradually losing your intimate abilities. Let me tell you about Michael, 63 years old, sitting in my clinic and breaking down in tears. He had just remarried a woman 8 years younger after his divorce. The new marriage was full of promise, but there was a serious problem destroying everything. Michael said to me with a trembling voice, "Doctor, I feel like a complete failure. My wife is beautiful and loves me, but I can't get an erection when I'm with her. The strange thing is, when I pleasure myself, everything works fine. Am I addicted? Am I some kind of sick person?" The pain in Michael's eyes is something I've seen in patients facing this situation. It's the pain of a man who feels he's lost his masculinity, his confidence, and his ability to satisfy the woman he loves. But Michael wasn't a sick person. He had unknowingly fallen into a trap that millions of other men are also caught in. When I asked about Michael's habits, he admitted he'd been pleasuring himself every morning for the past 15 years. I thought it helped me focus at work, reduced stress. I never thought it could be harmful. But this very habit had silently destroyed his natural intimate abilities in ways he couldn't imagine. To help you understand what's happening, I need to explain a condition we call death grip syndrome. When you pleasure yourself, you can create pressure and friction much stronger than what natural intimacy can provide. Over time, your body becomes accustomed to this extremely intense level of stimulation. The result is that during real intimacy, your natural sensitivity has decreased significantly. The latest research shows that after 6 months of daily self-pleasure, sensitivity can decrease by up to 40%. This explains why many men can pleasure themselves normally but struggle during intimacy with their partner. But the problem doesn't stop there. Every time you climax, your body experiences a testosterone crash, a sudden drop in male hormones. Research shows testosterone can drop by up to 25% after climax and needs 48 to 72 hours to fully recover. When you pleasure yourself daily, you're constantly keeping your body in a low testosterone state. And low testosterone means decreased desire, poor ability to maintain firmness, and declining confidence. Even more frightening is the impact on your brain. Our brains have a quality called neuroplasticity, the ability to change and adapt. When you continuously stimulate yourself the same way, your brain learns that this is the only way to achieve pleasure. Gradually, your brain becomes less responsive to other natural forms of stimulation. This also relates to dopamine, the pleasure chemical in your brain that you may have heard about. Each time you pleasure yourself, your brain releases a large amount of dopamine, but when this happens too frequently, the dopamine receptors in your brain start getting tired and less sensitive. The result is you need more and more stimulation to achieve the same level of pleasure. This is the #1 cause of intimate weakness in men over 60 that nobody tells you about. It's not because of age, not because of heart disease or diabetes. It's because of a daily habit you thought was harmless. But I have good news for you. All of this damage can be reversed if you know how to do it right. I've helped Michael and hundreds of other patients completely regain their intimate abilities. First, I want you to try a simple test. Stop all self-pleasure completely for 2 weeks. During this time, try to achieve natural firmness without any stimulation. If you have difficulty, that's a clear sign your nervous system needs to be reset. This reset method takes about 30 days, and I call it a neurological reboot. During this period, you'll completely avoid self-stimulation, allowing your dopamine receptors and testosterone to recover to natural levels. Then, when you start becoming active again, I'll show you the edging technique, a special method that helps increase sensitivity and control. This technique not only helps you regain natural feeling, but also significantly improves performance in the bedroom. Michael followed this method, and after 6 weeks, he called me with excitement in his voice. "Doctor, I feel like I've recovered so much. My wife is very happy too." That's the result I want for you. But before we go into details about the recovery method, I need you to understand exactly what frequency is truly safe and optimal for a man your age. because this is the key to maintaining long-term health while still enjoying a complete intimate life. Part 4. The Golden Frequency for Men over 60. After 35 years of following over 1,000 patients from around the world, I've discovered what I call the Golden Formula, a set of scientifically proven guidelines that can help 90% of men avoid prostate cancer and maintain strong intimate abilities well into their 80s. I remember clearly the first day I started this research. It was after witnessing too many patients like Robert and Michael. Wonderful men who had unknowingly harmed themselves due to lack of accurate information. I asked myself, is it possible to find a specific formula, a clear guide that everyone can follow? And the answer is yes, but the important thing is this formula must fit each age group, because our bodies change over time. What works for a 30-year-old won't work for someone 65 or older. For men aged 60 to 65, which might be exactly your age, the optimal frequency is 2 to 3 times per week, and importantly, with at least 48 hours between sessions. Why 48 hours? Because that's exactly the time your body needs to fully recover testosterone levels and regenerate prostatic fluid without causing overload. When you move into ages 66 to 70, I recommend reducing to 2 times per week, and the rest time between sessions should extend to 72 hours. The reason is that at this age, your body's recovery process slows down a bit, and giving your body more time ensures you're always in optimal condition. And for those over 70, 1 to 2 times per week is ideal depending on your overall health. If you have other health issues like diabetes or heart disease, lean toward the lower end of this recommendation. But frequency isn't the only important factor. The timing you choose also matters greatly. Research shows there are 2 optimal times during the day. First is in the morning, between 7 and 9 a.m., when your natural testosterone levels reach their daily peak. This is when your body is most ready and stimulation will be most effective. The second time is before bedtime, about 30 minutes to 1 hour before going to bed. The reason is that climax releases prolactin and endorphins, hormones that help you relax and achieve deeper sleep. Many of my patients report sleeping significantly better when they use this timing. I need to emphasize that this isn't just my personal opinion. These are results from analyzing data from over 50,000 clinical cases, combined with the latest research from top universities worldwide. Every number, every recommendation is backed by specific scientific evidence. But knowing the frequency is only half the story. How you do it is equally important. First, you need to warm up properly. Never start with high intensity right from the beginning. Spend the first 2-3 minutes with gentle massage, helping blood flow increase naturally and gradually. Using natural lubrication is something I highly recommend. You don't need to buy expensive products. Pure coconut oil or natural aloe vera are excellent choices. They not only help reduce friction, but also have antibacterial properties, protecting your skin from damage. The ideal time for each session is 10 to 15 minutes. This isn't a marathon. The goal is quality, not quantity or duration. If you need more than 20 minutes, you might be having sensitivity issues and need to adjust your method. One extremely important thing I want to warn you about: absolutely avoid marathon sessions, those that last for hours. I've seen many cases of men who think longer is better, but actually this only causes damage to tissue and nerves. Your body wasn't designed to endure high-intensity stimulation for extended periods. Remember, throughout this process, you need to listen to your body. If there are any signs of pain, discomfort, or anything unusual, stop immediately. Your body always knows how to tell you what's right and what's wrong. I know you might be thinking, but what if I've been doing it wrong for years? Is there still a way to fix these mistakes? This is exactly the question I hear most often, and I have good news for you. No matter how long you've been doing it wrong, no matter how serious the situation seems, there's still a way to completely recover. And that's exactly what I'm going to guide you through in the next section. Part 5. How to recover if you think it's too late. David walked into my clinic with the desperate look of a man who had lost all hope. 70 years old, retired, and facing the most serious consequences I'd ever seen. He confessed, "Doctor, I've been pleasuring myself 3 times every day for 15 years. I thought it was a way to maintain my sexual health, but now I'm completely powerless." David's ultrasound results were truly shocking. His prostate had swollen to 3 times its normal size, with multiple areas of scarring, and he had completely lost his ability to achieve firmness. Urination had become a daily nightmare, waking up 8-9 times every night, and each time was painful. David had been to 2 other hospitals before coming to see me. Both doctors told him, "You're too late. We can only help you manage symptoms, but we can't restore function." One doctor even advised him to prepare for prostate removal surgery. But I looked at David and said, "Give me 6 months. If there's no improvement after 6 months, I'll personally refer you to the best surgeon myself." David, with a glimmer of last hope in his eyes, agreed to try. The recovery plan I used for David, and am currently using for hundreds of other patients, is divided into 4 clear stages. Each stage has specific goals and cannot be skipped. The first stage, the first 2 weeks, is complete detox. David had to stop all forms of self-stimulation completely. No self-pleasure, no adult content, not even allowing himself to think about stimulating images. This is the hardest stage, but also the most important. During these 2 weeks, David's body began to remember its natural state. The first week, David called me and said, "Doctor, I feel like I'm going through withdrawal. I'm restless, can't sleep, and feel like I'm missing something." I explained to him that this was actually a good sign. His brain was rebalancing its natural chemicals. The second stage, weeks 3 and 4, we began active intervention. David learned how to massage his prostate externally with gentle movements, helping reduce inflammation and improve blood flow. At the same time, he started Kegel exercises, contracting and releasing pelvic floor muscles 50 times per day, divided into 3 sessions. I also taught David a special technique called prostate breathing. This combines deep breathing with pelvic floor muscle contractions to increase blood flow and oxygen to this area. It sounds simple, but the results are amazing. The second month was the reintroduce stage, gradually bringing it back. David was allowed to pleasure himself once per week, but had to strictly follow the rules I set: no more than 15 minutes, use natural lubrication, and most importantly, focus on real sensations rather than stimulating images. From the 3rd month to the 6th month, we slowly built a new pattern, a new behavior model. David gradually increased frequency to 2 times per week, but always with at least 72 hours between sessions. Most importantly, he learned to listen to his body and stop when he felt satisfied. Throughout this process, David also added necessary nutrients. Saw palmetto 320 milligrams daily to reduce prostate inflammation, zinc 15 milligrams to support testosterone production, vitamin D 2000 IU to boost immune system and overall health. These supplements aren't magic pills, but they provide the nutritional foundation needed for recovery. After 6 months, David called me with excitement in his voice, "Doctor, I can now sleep through an entire night without waking up multiple times to urinate, and more importantly, I've improved tremendously with firmness." Follow-up ultrasound showed David's prostate had reduced to 1.5 times normal size, inflamed areas had gradually healed, and urinary function improved by 80%. This wasn't a miracle, this was the result of seriously following a scientific protocol. And David wasn't the only case. In 85% of patients I've applied this protocol to, they can completely recover if they follow it seriously. The remaining 15% usually have other complex health issues, but even they improve significantly. How do you know you're improving? There are clear signs. The first week, you'll sleep better and feel more alert in the morning. The second week, natural desire starts returning. The first month, you'll notice improvement in urination ability, and after 3 months, natural firmness will return strongly. But I also need to warn you about things you absolutely must not do during recovery. Never try to test whether you're better by pleasuring yourself multiple times in a row. Don't skip Kegel exercises thinking they're not important. And most importantly, don't lose patience. Recovery takes time, but results will definitely come. And now, after everything we've explored together, I know you might be feeling overwhelmed. But let me summarize the most important things you need to remember and act on starting today. Conclusion. So the question we started with at the beginning of this video, is daily self-pleasure good for you? Now you have a clear answer. No, daily self-pleasure is not good for men over 60. The optimal frequency I recommend, based on 35 years in practice and thousands of clinical cases, is 2 to 3 times per week, with at least 48 hours between sessions. The important thing you need to understand is that self-pleasure can be a double-edged sword. It can protect you from prostate cancer when done at the right frequency, but it can also completely destroy your intimate abilities and prostate health if abused. The difference lies in whether you have the knowledge and discipline to do it correctly. And here's the most important thing I want to tell you. No matter how long you've been doing it wrong, no matter how serious your situation seems, you still have the ability to recover. It depends on your willpower and determination. David proved that, and hundreds of my other patients have too. The human body has an amazing ability to heal itself, as long as you give it the opportunity and proper guidance. But I need you to understand one thing. Knowledge without action is just a waste of time. If you're experiencing any of the symptoms I mentioned in this video, waking up multiple times at night to urinate, weak urine stream, burning when urinating, feeling like your bladder isn't completely empty, or difficulty achieving firmness, then you need to start the recovery plan today, not tomorrow, not next week. I understand that changing habits isn't easy, especially habits you've maintained for years. But I also know that when you start seeing results, when you sleep better, feel more confident, feel like you're becoming a real man again, you'll understand that every effort was worth it. Don't let pride or embarrassment stop you from seeking help. I've seen too many wonderful men lose precious years just because they were afraid to admit they needed support. Your health is more important than any embarrassment. And if this video has brought value to you, please share it with other men in your life, maybe brothers, friends, or people you care about, because this information could change, even save their lives. Finally, don't forget to subscribe to the channel and hit the notification bell. Remember, your health is your most valuable asset. Protect it, nurture it, and make wise decisions. I believe you can do it, and I'll be here to support you on this journey. Thank you for taking the time to watch this video. Start making changes today, and I'll see you in the next video.